So picture a modern IVF laboratory for a second. It is immaculate. You have these stainless steel incubators, highly sensitive microscopes, perfectly regulated temperatures.
Oh, yeah. It's the absolute pinnacle of clinical control.
Right. And the expectation there is that creating life is purely mechanical, like a perfectly timed injection here, an embryo transfer there. Just push the right buttons, right?
Like it's a math equation.
Exactly. But then, you step out of that lab and look at the actual human body trying to sustain that life, and you realize something fundamental. For you listening, whether you're prepping for natural conception or navigating the wild world of IVF, the human body is not a petri dish.
No, not at all.
It is a wildly complex, messy, brilliant ecosystem. And today, we are doing a deep dive into the underlying architecture of that ecosystem. We are tearing apart the protocols behind our source text today, the 4 pillars of integrative fertility support.
And it is such a vital distinction to make because we often get trapped in this false dichotomy. Like people think they have to choose between advanced Western reproductive medicine and natural holistic therapies.
Yeah, the whole either-or mindset.
Exactly. But the protocols we are looking at today completely shatter that. They don't ask you to choose. Instead, they outline how 4 specific, highly targeted therapies work alongside standard reproductive medicine.
To optimize the baseline.
Right, to optimize your body's baseline health so that whatever medical intervention you are doing actually has the fertile ground it needs to succeed.
Okay, let's unpack this because we need to start by actually preparing that ground. Before we can even look at individual cells or, biochemical fuels, we have to establish the physical environment.
Yes, the foundational layer.
And that starts with the oldest intervention on our radar today, which is acupuncture.
Which throws some people off. I mean, they hear acupuncture and think of ancient mysticism. But what modern clinical research has done is map those ancient concepts directly onto our very real, very physical anatomy.
Right. We are talking about the insertion of sterile, single-use, hair-thin needles into highly specific interceptions of the body.
Yeah, and 2,000 years ago, Chinese medicine practitioners call these pathways meridians. But today, anatomical science shows us that these points map almost perfectly onto major bundles of nerves, blood vessels, and dense connective tissue networks.
I want to focus on the blood vessel aspect because this is where the physical environment of the uterus changes. The goal here isn't just relaxation, it is actively altering blood flow.
Oh, absolutely.
Like when those specific points are stimulated, the body releases vasodilators. It actually relaxes the smooth muscle wrapping around the uterine arteries.
And what's fascinating here is the sheer volume of change that creates. Like when you relax that smooth muscle, you dramatically decrease the resistance in those blood vessels.
Think of it like an irrigation system in a garden. If the main hose is tightly kinked, you have all this life-giving water, so oxygen and nutrient-dense blood just trickling out.
Right, and the soil dries up. The environment becomes hostile.
Exactly. So acupuncture essentially unkinks that hose. It floods the pelvic cavity with blood. And that rush of oxygen and nutrients is exactly what a body needs to build a thick, 3-layered uterine lining.
Which is crucial.
Yeah, the text notes that lining is arguably the single strongest predictor of whether an embryo will actually implant and survive.
But we cannot ignore the neurological side of this because irrigation is only half the battle. You also have the overarching climate control system, which is the brain.
And this is where I need you to clarify the mechanism for me. Because we hear acupuncture calms the nervous system. But how does sticking needles into my skin lower my stress? Logically, if you poke someone with a needle, their stress should spike.
That is the instinct, sure. But these needles are so incredibly thin that they bypass our skin's pain receptors and instead trigger deep sensory nerves. Yeah, and that sensory input travels up the spinal cord to the brain and actively forces the nervous system to shift gears. See, when you are dealing with fertility struggles or, just modern life, you are marinating in cortisol. You are stuck in a sympathetic state.
The classic fight-or-flight mode.
Right. And from a pure evolutionary biology standpoint, if your brain thinks you're actively running from a tiger, it decides that this is a spectacularly bad time to bring a baby into the world.
That makes total sense.
Yeah, so it pulls resources away from the reproductive organs. It scrambles the delicate communication axis between the hypothalamus in your brain and your ovaries.
It essentially mutes the hormones that tell the ovaries what to do.
Exactly. It disrupts FSH, which is follicle-stimulating hormone, the hormone that literally tells your ovary to recruit and grow an egg. And it messes with LH, luteinizing hormone, which is the surge that triggers ovulation.
So how does the needle fix that?
Acupuncture stimulates the vagus nerve and pulls you out of fight or flight, dropping you into the parasympathetic state, the rest and digest mode. Once the perceived threat is gone, the brain turns the reproductive signals back on.
Wow. And the source mentions this is especially critical for people managing PCOS, right? Or highly irregular cycles where those hormonal signals are already prone to misfiring.
Oh, absolutely. It helps regulate estrogen and gets those signals firing correctly again.
And the timing of this intervention is incredibly specific. The text says, for natural conception, the protocol involves weekly treatments over 3 to 4 menstrual cycles to reset that brain-ovary communication.
Yeah, it takes a few months to reset.
But for IVF, the clinical standard focuses heavily on the days leading up to egg retrieval to maximize blood flow to the ovaries, followed by treatments immediately before and after the embryo transfer.
Right, to keep the uterus completely relaxed so it doesn't cramp and reject the embryo. And we absolutely must mention that this applies to male factor fertility as well.
Oh, true. Men need the blood flow, too.
Yeah, increased blood flow and reduced oxidative stress in the pelvic region are heavily utilized to improve sperm count, the motility, which is how well the sperm swim, and their morphology, which is their structural shape.
So if acupuncture repairs the irrigation system and gets the nutrient-rich blood flowing, that's a great start. But the actual cells utilizing those nutrients, the seeds in our garden, so to speak, still need a functional engine to grow.
They absolutely do.
Which brings us to low-level light therapy, commonly known as red light therapy. Here's where it gets really interesting. We need to talk about the sheer metabolic demand of a human egg.
It is staggering.
A single human egg contains roughly 100,000 mitochondria. Let me put that in perspective for you listening. A normal skin cell or muscle cell might have a few hundred, maybe a couple thousand mitochondria.
Yeah.
The human egg has 200 times more. Why?
Because the egg is the single most energy-hungry cell in the entire human body.
Yeah.
Mitochondria are the microscopic power plants inside your cells. When an egg is fertilized, it faces a monumental task.
Cell division, right?
Exactly. Within days, it has to divide from 1 cell into 2, then 4, 8, 16, all the way into a blastocyst consisting of hundreds of cells. That rapid, explosive division requires a massive, almost incomprehensible amount of cellular fuel.
So the mitochondria are supplying that fuel.
Yes, the health and density of a woman's mitochondria dictate whether an embryo will simply run out of gas and stop growing on day 3, or if it has the power to make it to implantation.
But the cruel reality of biology is that as we age, those microscopic power plants get tired. They dysfunction. Egg quality drops. So I'm trying to wrap my head around this. How does shining a red light on a human abdomen reach inside a cell and fix an aging power plant?
We have to get into the cellular biology here. First, let's be clear about what this is. This is not a thermal laser. It doesn't cut tissue or burn the skin.
So it's not hot?
No, it feels like a very gentle, warm sunbeam. But the specific wavelengths used, red and near-infrared light, have the unique ability to penetrate deep through the skin, the fat, and the muscle, reaching the internal organs.
And when that light hits an ovary,
It passes through the cell membrane and is absorbed by a very specific enzyme residing inside the mitochondria called cytochrome C oxidase.
cytochrome C oxidase, so the light is physically interacting with a biological enzyme.
Yes, it acts as a catalyst. When cytochrome C oxidase absorbs those photons of light, it kicks the mitochondria into overdrive. It wakes them up and forces them to produce significantly more ATP.
And ATP is the cellular fuel.
Right, adenosine triphosphate. It is the fundamental currency of energy in the body. More ATP means the egg has the raw power it needs to divide properly. Plus, it reduces cellular inflammation and accelerates tissue repair.
Okay, practically speaking, what does this protocol look like? The text says women are spending 20 to 30 painless minutes with these clinical-grade light panels positioned over their lower abdomen to target the ovaries and uterus, and over the lower back to target the vascular supply.
That's the standard protocol, yeah.
Yeah, but there is a male application here that honestly sounds a bit counterintuitive. Because for men, the light is applied directly to the testicles. Now, wait a minute, aren't testicles supposed to be kept cold? We hear all the time that hot tubs and laptops destroy sperm.
That is a brilliant point, and it's a very common misconception. Heat destroys sperm, yes. But remember, clinical low-level light therapy does not generate thermal heat. It is light energy, not heat energy.
Ah, so it's bypassing the temperature issue entirely.
Completely. And the studies on this are remarkable. By stimulating ATP production in the mitochondria of the sperm, it dramatically improves sperm motility. Remember, sperm have a long, arduous journey. They need an immense amount of energy in their tails to swim.
And the light therapy provides that localized energy boost.
Exactly. And the resulting improvements in motility can be measured in a matter of days or weeks, not months.
Wow. And the source also notes it's utilized extensively for women to calm the localized inflammation caused by endometriosis and to speed up tissue healing after the physical trauma of an IVF egg retrieval.
Right, but if we connect this to the bigger picture, we run into a biological wall. We have the irrigation from acupuncture, we have the sunlight and the activated energy from the red light therapy. Our cellular engines are awake and revving.
Sounds like we're ready to go.
Almost. But an engine running at top speed will completely burn itself out if you don't give it high-quality biochemical fuel.
Enter the third pillar, targeted supplements. And this is where we have to confront the classic American mindset. If you walk into a pharmacy or browse wellness blogs, the underlying message is always, more is better.
Oh, absolutely.
Take massive doses of every antioxidant you can find. Flush your system with vitamins. But, based on our source, that shotgun approach is incredibly dangerous here.
It really is, because fertility relies on highly delicate temporal balances.
Let me give you the perfect example of this from the text. The protocols highlight a fascinating paradox regarding inflammation. We are constantly told inflammation is the enemy.
Right? Lower your inflammation at all costs.
But a follicle, the fluid-filled sac in the ovary that holds the egg, actually relies on a localized spike in inflammation to physically rupture and release the egg during ovulation.
It is a required biological signal.
Exactly. If you decide to play doctor and suppress all your inflammation by swallowing a mountain of untargeted high-dose antioxidants, you can literally blunt that signal. You might accidentally stop yourself from ovulating because you were trying to be extra healthy.
Which is exactly why the word targeted is the operative word here. True supplementation is precision medicine. It requires looking at your specific blood work, your age, your genetic variants, and your pharmaceutical baseline.
So let's break down the mechanics of the major players mentioned in the text, because it's not just about taking a pill, it's about what that pill does on a molecular level. Let's start with CoQ10. We hear this one everywhere in the fertility space, but specifically, the protocols emphasize the ubiquinol form. Why?
Because CoQ10 is the literal spark plug for that mitochondrial engine we just talked about. It sits on the electron transport chain inside the cell. Without it, you cannot make ATP, regardless of how much red light you use.
And ubiquinol specifically.
The ubiquinol form is the active bioavailable state. For women over 35, whose natural CoQ10 production has plummeted, this is non-negotiable for egg quality. And for sperm health, too, honestly.
Got it. Next is DHEA. This is a fascinating one because it's actually a a male sex hormone produced by our adrenal glands.
And this requires immense caution. DHEA is utilized primarily for women diagnosed with diminished ovarian reserve, or who are poor responders to IVF stimulation meds.
So it's not for everyone.
Definitely not. The ovary needs a certain baseline of androgens to develop healthy follicles. But if your levels are already normal, adding DHEA can toxify the ovarian environment. It is a powerful tool, but it absolutely requires clinical supervision and regular blood testing.
Okay, then we have myo-inositol and dechiroinositol. These are generally highlighted as game changers for PCOS or polycystic ovary syndrome.
Yeah, and that's because PCOS is heavily driven by insulin resistance. When the body becomes deaf to insulin, the pancreas pumps out more of it, and those chronically high insulin levels force the ovaries to overproduce testosterone.
Which halts ovulation.
Right. So these specific inositols act as secondary messengers in the cell. They resensitize the body to insulin. When insulin drops, testosterone drops, and natural ovulation can resume.
That is so cool. Okay, vitamin D is next. And the data shows we need to stop thinking of vitamin D as just a bone health supplement.
Oh, for sure. There are vitamin D receptors covering the entire reproductive system. The ovaries, the uterus, the placenta.
The text mentions that if your levels are deficient, the research shows a measurable drop in IVF success rates and a statistically significant increase in the risk of miscarriage.
Yeah, it is a foundational hormone regulator. We also look heavily at omega-3 fatty acids, specifically EPA and DHA.
Those are the fish oils, right?
Mostly, yes. These are your structural fats. They incorporate themselves into the cell membranes of the egg and the sperm, keeping them fluid and healthy. They also provide a controlled, targeted reduction of systemic inflammation without blunting that ovulatory signal we mentioned earlier.
Perfect. Then there is the B vitamin complex, but we have to get extremely specific here. Standard prenatal vitamins use synthetic folic acid. But a massive percentage of the population carries a genetic variant called MTHFR.
Right. The MTHFR gene provides the instructions for an enzyme that converts synthetic folic acid into its active, usable form. If you have this mutation, your body simply lacks the workforce to do that conversion.
So taking standard folic acid creates a metabolic roadblock. The unconverted synthetic vitamin just builds up in your blood while your actual cells are starving for the active nutrient.
Exactly. This is why targeted protocols demand methylated folate, along with methylated B12 and B6. The methylated part means the nutrient has already been pre-converted in a lab.
So it skips the roadblock.
It completely bypasses your genetic roadblock and enters the cell immediately to support cell division, prevent neural tube defects, and aid in healthy embryo development.
Incredible. And finally, NACN-acetylcysteine. The text states this acts as a precursor to glutathione, which is your liver's master antioxidant.
Yeah, it's highly effective at managing the deep, scarring inflammation associated with endometriosis and reducing the factors that contribute to recurrent pregnancy loss.
So when you analyze these, you aren't just looking at a grocery list of vitamins. You are looking at specialized biochemical tools. They alter insulin, they build membranes, they bypass genetic mutations.
Precisely.
Okay, let's step back and look at the ecosystem again. We have the irrigation system optimized with acupuncture. We have the energy supplied by light therapy. We have the precise nutrients loaded in through supplementation. But we are missing the architect.
We need a blueprint.
Right. We need a master blueprint that tells the body exactly how to synthesize all these things across a wildly fluctuating 28-day timeline. And that is the fourth pillar, custom Chinese herbal formulas.
And this is perhaps the most misunderstood pillar. A custom formula is not a generic fertility tea you grab off a supermarket shelf.
Right.
It is a highly potent, custom compounded pharmacology. A board-certified herbalist is blending 8 to 15 distinct ingredients, roots, barks, seeds, minerals, and boiling them down to extract their specific active alkaloids. They customize it based on indicators like your pulse, your tongue, your cycle pattern, and your lab work.
But hold on, I want to push back on the mechanics of this, because the defining characteristic of the female reproductive cycle is that it is never static.
Very true.
Your hormones on day 4 are completely different from your hormones on day 20. How can a single bottle of herbs possibly adapt to a body that changes every single week?
Well, it can't. If someone hands you one bottle of herbs to take all month long, they aren't practicing custom herbal medicine. The protocols dictate a dynamic, shifting prescription. The herbalist writes one highly specific formula for the follicular phase, which is the first half of the cycle.
So that formula is strictly designed to grow the follicle and thicken the uterine lining.
Correct. But the moment you ovulate, the biological goalposts move. Your body no longer cares about growing a follicle. It cares about sustaining a potential embryo.
Oh, I see.
So the practitioner pulls you off that first formula and prescribes a completely different combination of herbs for the luteal phase. This second formula is designed to support the corpus luteum, boost progesterone production, and warm the uterus to encourage implantation.
So it truly is a dynamic blueprint. And the targeted applications mentioned in the text are incredible. They use these shifting formulas to regulate erratic menstrual cycles, improve the blood supply to the pelvic basin, and aggressively manage the agonizing pain of conditions like endometriosis and adenomyosis.
And we should define adenomyosis for a moment because it often gets lumped in with endometriosis, but it requires a different approach.
Yeah, please do.
Endometriosis is when tissue similar to the uterine lining grows outside the uterus. Adenomyosis is when that tissue actually grows deep into the muscular wall of the uterus itself, creating intense swelling and cramping. Herbal formulas are remarkably effective at shrinking that localized swelling.
Wow. This raises a massive point about safety, though, because we are talking about ingesting complex biological compounds that actively alter your hormones. You cannot just buy this stuff from a random seller on the internet based on a social media review.
This raises an important question that the integrative community takes very seriously. Herbal medicine must be prescribed by a board-certified herbalist who understands Western pharmacology.
Because of drug interactions, right?
Exactly. Because herbs can interact with your medications.
Yeah.
If you're taking blood thinners or thyroid medication or IVF stimulation drugs, the herbalist must know exactly which botanicals to avoid.
Furthermore, the text warns that the actual sourcing of the dirt and plants matters. The protocols demand utilizing suppliers who run extreme laboratory testing on their herbs to ensure there are no heavy metals, no pesticides, and no pharmaceutical adulterants.
It has to be incredibly clean.
So what does this all mean? Let's bring all of this together. We started with the sterile, mechanical expectation of modern fertility treatments. But what we've uncovered is a profoundly interconnected web.
Yeah, a complete ecosystem.
We have tiny needles regulating the brain's stress response and driving blood flow. We have near-infrared light fundamentally altering the energy production of microscopic mitochondria. We have targeted supplements bypassing genetic mutations, and we have shifting botanical formulas acting as the master architect.
And it proves that you do not have to choose between science and holistic care. They are better together. When you optimize the ecosystem, addressing the egg, the sperm, the uterine environment, the immune system, and the nervous system all at once, you exponentially increase the efficacy of whatever medical path you are on.
It's all working in concert. For you listening, whether you are trying to conceive, supporting a partner, or you're just fascinated by biohacking, this completely reframes how we view the human body. It demonstrates that the body is an interconnected ecosystem, not a collection of isolated parts waiting for a mechanic.
And, looking at this interconnected framework leaves us with a rather profound thought to consider for the future. The ancient Chinese medicine practitioners mapped pathways of energy flow thousands of years ago.
Right.
Today, modern science uses red light therapy to stimulate cytochrome-6 oxidase to produce ATP, which is literal cellular energy.
Oh, wow.
It really invites you to wonder, is modern biology simply finding the microscopic vocabulary for the exact same physical truths that ancient herbalists and acupuncturists were reading in a patient's pulse and tongue 2 millennia ago?
That is a staggering question to leave on. The vocabulary changes, but the ecosystem remains the same. Thanks for joining us on this deep dive, and we'll see you next time.